Good morning, everyone, and welcome to our weekly briefing. So over the past week, COVID-19 cases have remained extremely high, but they may be starting to plateau, although it's too soon to be certain. Hospitalizations in Philadelphia have continued to increase, which is not surprising given the lag we usually see with COVID-related hospitalizations. As of yesterday, we were seeing an average of 2,978 new cases per day, down very slightly from the 3,108 I reported last Wednesday. And the percentage of tests that are coming back positive has fallen slightly to 31.5%. Conditions at Philadelphia's hospitals remain extremely stretched, and many are delaying surgeries that can be delayed. Staff shortages are impacting many healthcare institutions, from hospitals to COVID testing sites, with many out because of COVID infections. We are still seeing that most people hospitalized and most people dying from COVID in Philadelphia are unvaccinated. I continue to strongly encourage every Philadelphian who has not been fully vaccinated and boosted to get their shots as soon as they possibly can. Most Philadelphians have done that. More than 95% of adults have had at least one shot and 78% are fully vaccinated. More than 245,000 have had their boosters. 91.9% of those 12 and up have had at least one dose, and 72.3% are fully vaccinated. And 29.1% of 5 to 11-year-olds have had at least one dose of vaccine. With cases still very high and tests still in short supply, it remains very important for any of us who have COVID-like symptoms or an exposure to someone with COVID to isolate away from others and only to go to an emergency room if you have a true emergency. Please do not use emergency services unless you need them. That will help keep services available for people who have an urgent medical problem. If you cannot find a testing center appointment or a home test, please assume you're positive and take precautions accordingly. I know that many people right now are frustrated. We're hearing that Omicron is milder, and yet we still have restrictions in place that make normal life seem impossible. We wonder when this will come to an end and when we'll be able to move on to the many other important challenges our city faces and to the lives that have been interrupted by COVID. I don't have a crystal ball, although I've wished more than once that I did. But here are the bits of hope that I'm holding on to as we all try to get through this difficult January. 1, people who've been boosted really do seem to be well protected against serious illness with Omicron. This is in line with the kind of protection we see with many childhood vaccines, where we need a primary series followed by a booster for good protection. 2, our country is making real progress with providing COVID vaccines to the least vaccinated areas of the world, which holds promise to end the cycle of new variant after new variant. 3, Philadelphians are stepping up to get vaccinated at a much higher rate than we were a few months ago, with 30 to 40,000 doses being given in the city each week. And 4, mask use in Philadelphia has risen again to the level seen earlier in the pandemic. So let's get through January together with walks outside with friends instead of indoor gatherings, with double masking or KN95 masks to protect us inside, and with the knowledge that we may be seeing the light at the end of the tunnel at last if we can be careful a bit longer. And please, please, everyone, get your boosters. To wrap up, if you'd like more information about the pandemic and the city's response, you can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. Now I'll turn it over to Zelly to present these remarks in Spanish.
Buenos días y bienvenidos a nuestra sesión informativa semanal. Durante la semana pasada, los casos de COVID-19 se han mantenido extremadamente altos, pero pueden estar comenzando a estabilizarse. Las hospitalizaciones en Filadelfia han seguido aumentando, lo que no es sorprendente, dado el retraso que solemos ver con las hospitalizaciones relacionadas con COVID. Hasta ayer, estamos viendo una media de 2,978 nuevos casos diarios, muy ligeramente por debajo de los 3,108 que informé la pasada miércoles. Y el porcentaje de pruebas que están dando positivo ha caído ligeramente hasta el 31.5%. Las condiciones en los hospitales de Filadelfia siguen siendo extremadamente tensas y muchos están retrasando las cirugías que pueden retrasarse. La escasez de personal está afectando a muchas instituciones. Atención médica desde hospitales hasta sitios de pruebas de COVID y muchas de ellas debido a las infecciones por COVID. Todavía estamos viendo la mayoría de las personas hospitalizadas y la mayoría de las personas que mueren por COVID en Filadelfia no están vacunadas. Sigo alentando encarecidamente a todos los habitantes de Filadelfia que no hayan sido completamente vacunados y potenciados a que reciban sus vacunas lo antes posible. La mayoría de los habitantes de Filadelfia han hecho eso. Más del 95% de los adultos han recibido al menos una inyección y el 78% están completamente vacunados. Más de 245,000 han tenido sus refuerzos. 91.9 de los mayores de 12 años han recibido al menos una dosis y 72.3 están completamente vacunados. Y el 29.1% de los niños de 5 a 11 años de edad han recibido al menos una dosis de vacuna. Con los casos aún muy altos y las pruebas aún escasas, sigue siendo muy importante para cualquiera de nosotros que tenga síntomas similares a COVID o una exposición a alguien con COVID, aislarse de los demás y solo ir a una sala de emergencia si tiene una verdadera emergencia. Por favor, no utilice los servicios de emergencia a menos que le necesite. Eso ayudará a mantener los servicios disponibles para las personas que tienen un problema médico urgente. Si no puede encontrar una cita en el centro de pruebas o una prueba en el hogar, asuma que está positivo y tome las precauciones y consecuencias. Sé que muchas personas en este momento están frustradas. Estamos escuchando que Omicron es más suave y sin embargo todavía tenemos restricciones que hacen que la vida normal parezca imposible. Nos preguntamos, ¿cuándo terminará esto y cuándo podremos pasar a los muchos otros desafíos importantes que enfrenta nuestra ciudad y a las vidas que han sido interrumpidas por COVID? No tengo una bola de cristal, aunque he deseado más de una vez que lo hiciera, pero aquí están los pedazos de esperanza a los que me estoy aferrando mientras todos tratamos de superar este difícil enero. Las personas que han sido impulsadas realmente parecen estar bien protegidas contra enfermedades graves con Omicron. Esto está en línea con el tipo de protección que vemos con muchas vacunas infantiles, donde necesitamos una serie primaria seguida de un refuerzo para una buena protección. Nuestro país está haciendo un progreso real en el suministro de vacunas COVID a las áreas menos vacunadas del mundo, lo que promete poner fin al ciclo de una nueva variante tras otra. Los habitantes de Filadelfia están dando un paso adelante para vacunarse a un ritmo mucho más alto que hace unos meses, con 30,000 a 40,000 dosis administradas en la ciudad por semana. El uso de mascarillas en Filadelfia ha vuelto a subir a los niveles vistos anteriormente en la pandemia. Así que pasemos enero juntos con paseos al aire libre, con amigos en lugar de reuniones en interiores, con doble enmascaramiento o máscaras KN95 para protegernos adentro. Y con el conocimiento de que podemos estar viendo la luz al final del túnel, por fin, si podemos tener cuidado un poco más. Y por favor a todos, obtengan sus refuerzos. Para concluir, si desea obtener más información sobre la pandemia y la respuesta de la ciudad, puede visitar nuestro sitio de web en phila.gov/COVID. Si tiene preguntas, llame a nuestro centro de llamadas COVID al 215-685-5488. Gracias, thank you.
Thank you very much for that, Zelly. We will now move to the question and answer portion of the program. If you have a question, please raise your hand using the raise your hand function, and we will take those questions in the order they were received. As noted earlier, we ask that media outlets coordinate internally and keep their questions focused on today's topic. If there are any reporters who do not get an opportunity to ask questions or have questions about other topics, please follow up with us by email and we will get you an answer. First up, we have Lauren Make from NBC 10. Let me unmute you. Go ahead, Lauren, ask your question.
Hi, good morning. Hi, Dr. Bedigal. First, I wanted to ask you about the masks. You have suggested that people start either double masking or using the KN95 masks. Is there any thought to distributing the more protective N95 or KN95 masks to people who might not have access to them? And also, how many times can those be used?
So that's a great question. With the N95s, KN95s, they can be reused, usually up to a week. I mean, once it starts getting soiled or wet, you really wouldn't want to use it again. And you want to be careful how you handle it. So if you've touched the outside of the mask, you want to wash your hands. We have talked internally about, whether there are situations within the city where we could distribute them. Distributing to a city of 1.6 million is a daunting task. But in certain specialized situations, we're discussing right now. The challenge is that people don't need one, right? They need a supply of them. And the other thing with these masks, there can be difficulties with fit. Like, you need a mask that fits you well. The most important part of the N95s or the KN95s, or if you've heard of the KF94s, which are similar, is that they fit without gaps on your face. So a widespread distribution won't necessarily achieve that. This is also one of the reasons that I talk a lot about double masking, because the filtration with a cloth mask over a surgical mask is almost as good as with one of these KN95s or other. They are much more affordable, they're much more comfortable. And in terms of feasibility across a city, it seems much more achievable. So that doesn't mean that we won't, in some situations, decide to do a distribution, but to give people, say, a 6-month supply of these masks would be incredibly expensive and a huge lift. So we just want to make sure that we're putting both the dollars and the work of staff into things that make the most sense right now in the pandemic.
Okay. On testing, I know that the health department has tried to order at-home tests, tried to order quite a few of them. What's the status of that? Have you received any of the at-home tests that you have ordered, and when might they be available for people?
So we're still waiting for the large order to come in, and we'll be announcing a distribution plan for that when we have those tests. We're expecting to have them very soon. We just have
within the next week or so?
I'm hoping. I mean, everything always takes longer than I believe possible, but hopefully within the next week or two, to be able to get them to people. I think we all have to realize that, again, 1.6 million people, we don't have nearly that many tests coming. So this is going to be an ongoing problem that we're going to be struggling with. We are going to be focused on getting the tests to the people who need them most and can afford them least. There's also the federal distribution through the online distribution network, which is coming soon. And then this announcement that people with private insurance will be able to get tests covered. So there's a variety of ways to get people tests, but I think it's still not sufficient.
And finally, on schools, I know you've continued to be in contact with the school district on how they handle things. And we've continued to see this rolling situation, which I know you have supported in-person schools, but it also has been difficult for parents to kind of keep track of what's happening. Is this the way it's going to continue, just a rolling situation, or are you looking at something else?
Well, I think, firstly, we're at one of the most difficult times of the pandemic just because of the sheer number of cases and what that means for staffing. So when we think about schools, you can't run a school if you don't have staff. I do think we're going to be in a difficult place for at least the next couple of weeks in terms of what that looks like. And, because the alternative to these rolling what people have called functional closures, meaning we don't have enough staff to keep the building open. The alternative is just closing schools down, which is clearly worse for kids. We are doing our best to work with the district. They are also doing their best to keep schools open. And then we're in active discussions with them and with colleagues at CHOP about these new guidelines from CDC, about the CHOP announcement. We'll be putting out new guidance very shortly.
Thank you.
Thanks, Lauren. Next up, we have Jason Loughlin from the Inquirer. Jason, if you
Hi, thanks. Yeah, I'm here. Yeah, thank you. Thanks for taking the questions. A couple things. First off, could you talk about whether there's been disruption within city services as far as police, fire, from people who are infected and aren't going to be able to work? Are you having any staffing issues there?
You know, I think everyone is having staffing issues right now. We haven't reached a crisis point with the city, but you know, like everyone else, we have people who are out with COVID right now or who are quarantined because of their recent exposure. And, you know, I think we're going to do our best to get through the next couple of weeks. Things are not as bad here as they are in other places from what I'm hearing, but, you know, still a very challenging time for everybody.
Do you have any information on how many hospitals in the city are on diversion right now that are sending patients to other hospitals?
You know, I heard early this morning that there was a hospital outside the city on diversion. I'm not aware at this moment of city hospitals that are on diversion right now. In general, they have been stretched, but not in a crisis situation, as we've heard with other places. But if that's changed in the last few minutes, I might not be aware.
Okay, and I'm sorry, last question. Looking forward, do you have any estimates of when the peak of this Omicron surge is going to be coming? And if there's any additional restrictions or steps that are going to be taking in those coming weeks as that peak approaches, or is it here now?
Well, the thing about watching things like this is you're watching a graph, you're doing your best to project, and there's no certainty to any of this. So from the numbers I'm looking at right now, it looks like we may be at peak right now. You know, I think we're going to see wiggle over the next few days. And then it's just a question of whether we all can hold it together and manage not to expose ourselves. I mean, I think we saw a giant exposure over Christmas. It looks to me like Philadelphians were a bit more cautious over New Year's, and we haven't seen a massive increase the way we saw over Christmas. But it depends what we do next to hold that. So, you know, hopefully this is peak and things will start getting better from here on in. But you know, we all need to, this is personal. This is about each of us thinking about what we're doing, the risks that we are taking for ourselves, for our families, and trying to prevent the spread of this, essentially to keep our hospitals from overflowing.
And real quick, could you say why looking at the numbers now, you think this could be the peak, what indicators you have?
So, you know, I look at a tremendous amount of data every day, thanks to a really wonderful team of epidemiologists. So we look at case counts, we look at hospitalizations. We also look at something called syndromic surveillance, which is the chief complaints of people coming into local emergency departments by zip code, by age. You know, all of those things are looking to me like we may be at the top of the curve. But when you see a little plateau like that, it's hard to know, is that, you know, a little bump on the way up further, or will the curve actually continue down? So, you know, I think we all have to wait and see a bit longer before we'll know for sure.
Okay, thanks, Doctor.
Thanks, Jason. Next up, we have Alan Yu from WHRY. Go ahead, Alan.
Hi, can you all hear me?
Yes.
Okay, thank you. So first question, I know I asked this like maybe a year ago now, but I'm curious, can you talk a little bit about how much capacity the city or labs in the city have when it comes to doing genomic sequencing of virus samples that come in right now?
Sure. So I would defer on details of this to Penn and to CHOP, where the sequencing labs in the city currently exist. We are working on building a sequencing lab in the public health lab, but that is not yet open. So there are 2 existing sequencing labs. In general, sequencing capacity in the country is not nearly what it needs to be for us to handle this pandemic or other pandemics and be able to understand new variants as they emerge.
Thank you. Are there any details about the sequencing lab that's being built? I didn't know that was happening.
Well, it's not done yet. So we're hoping to have it up and running by June. Again, everything always takes longer than I think. But we have a wonderful lab director who's been hard at work on that in the midst of handling a tremendous load with this pandemic. Our public health lab does a lot of COVID tests in addition to every other test that they run for our city health centers, for the prisons, for a variety of other healthcare settings. So, they've been working on getting the equipment in, getting the staff hired. They've made good progress, but we're not quite there yet.
Okay, thank you. The last question I have, you talked about the importance of having a good fit on a mask. I'm wondering if you can talk a little bit more specifically about advice for people with children under 5 who can't get vaccinated right now. And, I'm not sure about the availability of children-sized KN95s or N95s right now.
So there are children-sized high filtration masks, so the KN95s and the KF94s. What I've been told is you essentially need to try a bunch on to find one that fits your child well. So you want a good seal, right, covering the nose around the mouth. You also want a mask your child is comfortable enough in that they're not constantly pulling at it. So, and that's for 2 to 5-year-olds, right, because kids under 2 really can't wear a mask. So for the 2 to 5-year-olds, if you decide to go with one of those masks, you'll want to try a few and make sure you find something that fits well. Some of them have adjustable ear loops where you can kind of tighten it or loosen it depending on the fit. And again, consider, there are small size surgical masks. You can put a good fitting cloth mask over the top of that, seal those spaces. The best mask for a child that age, just with the rest of us, is the mask that they will consistently wear. The one thing I would say is just a single layer cloth mask right now really isn't enough. So we want to make sure that kids are protected as well. For kids under 2, it's really about the environment they're in. We can't put a mask on a baby. So that means that everyone who's around that baby needs to be as careful as possible. We're not taking babies into situations that are crowded indoor spaces. We want everybody around them vaccinated and as up to date as they can be with their vaccines. As few people as possible around those infants. So, if you're having a party, for example, don't want a baby at a party, but you also don't want someone who's exposed to a baby at a party because they could bring that infection home to that infant.
Got it. Thank you.
Thanks, Alan. Next up, we have Isabel Sanchez from Telemundo. Go ahead, Isabel.
Hi there. Good morning, Dr. Betigol. My question is regarding the FEMA testing site in Southwest Philly. How is it working right now? And are you guys maybe hoping to expand to open maybe another facility or see more tests being made there?
So the testing site at Sabati Rec Center, by the reports I've gotten, has been working smoothly. It's available. People can schedule or they can walk up, and we're really stressing the walk-in capacity at that site for equity reasons. People have been using it. I've had good reports from people who've been there about the service that they got. In terms of further expansion, we are working with a community partner and with FEMA on additional testing, hopefully to open in the next few weeks.
And this would be located in different neighborhoods, I take.
Yes, that's correct.
Thank you so much.
All right. Thank you, Isabel. Seeing that we have some time left, I'll ask for any follow-up questions if there's any reporters that have any. Okay, seeing as we're coming up on 10:30 and I don't have any other hands raised, we will end this briefing. This briefing is usually held weekly on Wednesday mornings, and the details on the next briefing will be issued via media advisory. Thank you, everybody. Have a good day.